Hello, future nurses. How are you? Excited to see you today. Background just had a little bit of a minute there, so I'm gonna fix this really quick. I'm excited to see you. I know we are starting just a little bit early, looks like. So today is all about coffee and conversations, but today I forgot my coffee, so I have a little something different. I found this different soda at the store. I'm trying it out and I'm kind of enjoying it. So I'm interested to hear, where are you joining me from? So go ahead, let me know in the webinar chat where you're joining me from. I am in sunny, a little bit windy South Dakota today. It's gorgeous, but it is a little bit too windy for me, but that's all right. So where are you joining me from? And you should see a couple different options here. You'll see the webinar chat. You will see the Q&A. So let me make sure that's open for everyone. Yep. All right. So today is all about kind of discussing things that are really important, things that come to mind, things that we hear most often. And so I want to start off by sharing with you um, a little something from the dashboard. So let me go ahead and open this one. All right. So on your screen, you should see our dashboard. So I'm going to go ahead and, oh, gotta log into mine here. So a few things that's really difficult for students to figure out when they're first getting started, whether it is, well, let's first just talk about the students who are just getting started studying for the NCLEX. So, something that is not commonly known is, how do I decide on which program is best for me? So, there's a couple different things. You'll notice that when you go to the website, you're going to see two major products. You're going to see SurePass and you're going to see Intense Prep. So, I want to talk a little bit about the difference between those things. So, when you are a brand new grad, maybe you just graduated or you're getting ready to graduate, if you have taken a NCLEX prep course, you're like ready to go. SurePass is my recommendation for you. If you're someone that's personally motivated, you're able to kind of get yourself off the ground, SurePass is for you. It's going to have everything you're going to need. It's going to give you access to the study plans. It's going to give you access to the Q Bank with over 2,000 NCLEX style questions. It's going to give you access to readiness assessments and all of the things. So that is a good one. The next one is Intense Prep. Intense Prep is just that. It's intense. It is a 6-week program where you have your own ebook, your own study plan, and you will follow that, basically what it's telling you to do each day. Along the way, on weeks 2 through 6, you will receive individualized feedback to your inbox with a video on weakness areas, areas of strength, things like that. Those are going to be really helpful for you. So those are the difference between SurePass and Intense Prep. So when you go into your dashboard, you're going to find the study calendars over here on the right. So we have a 3, a 4, a 6, a 12. So 6 is usually what I recommend for new graduate nurses. You could maybe even do the 4. The 9 and the 12 are more for students who are repeat test takers. And repeat test takers, I almost always recommend the Intense Prep Intense Prep program. Now, the next question that I hear really frequently is, how do I know if I am ready to test? Well, there's a couple different things that let us know if you're ready to test. One, have you gotten at least 4 to 5 highs or very highs on your readiness assessments? That's a big one. The next one is, have you gotten at least 80% of the way through the Q Bank? That's another big milestone. So once you've done those two things, you've gotten at least one pass on your CAT we recommend go ahead and scheduling your test. So all three things combined are really important to your success. And it's a lot of what we are looking at. Now we look more at the readiness assessments because those are going to tell us more about are you ready to test? And when you're having that streak of 4 to 5 highs or very highs, that gives us a high probability. So that's how to know if you're ready to test. That's how to know which product to choose. So I'm curious, what are some of the major questions that you have? What are some things that you're really struggling with in your time preparing for your NCLEX? Let me know. Okay. Okay, so one thing that I really struggle with is when do I start testing? Okay, so how do you know when to start your review program? I usually recommend a couple weeks before graduation. Now, a lot of you take a class that is going to help prepare you for taking the NCLEX and kind of knowing if you're ready to go, if you're on par. And so a couple weeks before that, our Q bank is really going to help you. Now, something else that I want to show you is that when you go into the Q bank, so we're going to do this together. We're going to go into the Q bank and we're going to do just one question. So we're going to look at a classic question and we're going to do, just going to do two. So let's do this one. And if I haven't introduced myself and we haven't met before, my name is Jennifer Bonner. I serve as the manager of nursing services here at Archer Review. So I've been a nurse for over 13 years. I'm a certified nurse midwife. I've graduated with my FNP. I have a doctorate in nursing, and I absolutely love what I do. So this is so much fun to get to walk alongside students as they're preparing for the NCLEX. All right, so we're caring for a 2-hour-old infant at risk for cold stress. Which of the following assessment findings would support an early finding of cold stress? Okay, so there's a couple things that I notice here. A infant we're caring for 2 hours old, they are at risk for cold stress. So we're looking to figure out which of these is early sign of cold stress. Is it shivering, hyperglycemia, tachycardia, or bradypnea? What do you think? Let me know in the webinar chat. Great. Seeing some of you say bradypnea, someone saying tachycardia. All right, let's go ahead and choose. Oh, I see a couple more. Okay, I'm going to hold on for just a second. All right, looks like tachycardia is winning. So let's go ahead and reveal our answer. Now, one thing that's really important when you're going through tutorial mode is that you will get the answer right away. So we actually got it right. So the next thing I want you to do is go through the right answer and make sure that you understand the why behind it. Why is it letter C? Well, when an infant's temperature decreases, we know that their heart rate goes up. It has this inverse effect, right? One goes up, the other goes down. So because of what's happening is we have that peripheral vasoconstriction. So it's trying to shunt the blood to those most vital organs in the middle of the body, like the heart and the lungs, right? And so because of that, the heart rate does what? It goes up, okay? So tachycardia, tachypnea, cyanosis, those are my early signs of cold stress. Okay, so once you get to the point that you can explain to me why it's letter C, why isn't it letter A? Well, infants don't shiver right away. It usually takes them to about 6 months before they have that mechanism. So we could already eliminate letter A. Letter B, hyperglycemia. Well, we know that when an infant has cold stress, it actually increases their metabolic rate. And because of that, it might drive their blood glucose down. So it would actually be a better option if this said hypoglycemia. That would be something that we would want to look at instead of hyperglycemia. So it's actually just the opposite. And then letter D, cold stress actually goes with tachypnea. So this question is basically finding out, do you know what's going on with the baby when they are experiencing cold stress? So their respiration rate actually goes up, and because they need that extra demand for oxygen. So bradypnea would actually be a late sign. Now, if you're ever concerned and you need a little bit more help, you can always click on this video here and it will take you
Next thing I want to touch on for
to
infant
the
stage
spot
is
right there, and you'll see it there at the bottom of my screen. It tells you about what's going on. It will take you right to the spot where it explains that. So let's look at the next one together here. So the nurse is caring for a client in labor. During a contraction, the nurse notes a decrease in the fetal heart rate from 150 to 120. The heart rate shows for about 10 seconds and increases back to 150 as the contraction ends. Which of the following correctly classifies the observation? So what are some key findings that we see here? What are some key findings that we see here? Okay, so some key things is that we are in the middle of a contraction. We have a decrease in the fetal heart rate about 30 beats per minute. And then it's increasing back to 150 as that contraction ends. So this tells me that it's going to look very similar to this. So we have a contraction, and here's what's happening with my fetal heart rate. So sometimes it's really helpful to draw this out. You know that you'll have a whiteboard when you are taking your exam. And so I want you to make sure to know that you can utilize that whiteboard. The whiteboard is actually your friend. So if we can map this out, this gives me a better idea of what we're looking at. So if this is what I'm seeing on the monitor, how would you classify this? What would you say? What would you call it? So there's a couple things that we can already go ahead with. We know that this is a decrease in the fetal heart rate, so we know it's a deceleration. So we can automatically eliminate letter B because we're not talking about variability, and we can already eliminate letter D because we're not talking about variability, right? So we have two different options. So we've now increased our chances of getting this question right to 50%. So now we have to figure out, do we have a late decel or an early decel? Well, I know that late decels are going to occur after the contraction, and this says that I'm back up to 150 as the contraction ends. So that leads me to believe that we have a early decel, and it looks like we were correct. So let's go ahead and get rid of our drawings here. And let's talk about this. So again, we want to get to the point where we can explain why is the right answer right? Why are the wrong answers wrong? Well, we just talked about how we know that an early deceleration happens during the contraction. So it's essentially a mirror of the deceleration. And we know that the normal fetal heart rate is anywhere from 110 to 160 beats per minute. So why isn't it a late? Well, we know that late decelerations are a decrease in the fetal heart rate, and it happens after the contraction. So it starts after the contraction has started, and it ends after the contraction has gone away. Why isn't it a moderate variability? Well, fetal variability is just the changes from fetal baseline. So our heart rates are not always the same. There's things that excite us, things that slow things down. Okay. And so as we're going through that, we know that we're going to have changes in our heart rate, just like a fetus would. So we know it's not variability. And because we know it's not variability, we also know it's not marked variability. And so I want to show you on the screen the difference. So moderate variability is just little fluctuations, little changes, versus marked variability reminds me of a kiddo that took a marker to the wall. So this actually happened in my home when we had a toddler. One of them actually grabbed a Crayola marker, one of the big ones, and just went to town on one of my cube organizers. And so ever since then, I can't get it out of my head. Marked variability, this is what it looks like. All right. Excellent job on that one. So I know that one was a little, depending on where you're at in that knowledge, might have been a little bit easy for you, may have been a little more difficult for you. So I'm curious, what other questions do you have? Where are you struggling? Yes, you can go ahead and let me know what your questions are in the Q&A or the webinar chat, whichever one is most convenient for you. The other thing I want you to know is that when you go through with your SurePass, you also have available these cheat sheets in here that can be really helpful for various different things. So this one's on SATA questions. There's test taking strategies. Sometimes we forget that those are there or don't realize that they're there. So I want to make sure to point those out. My favorites are when you go into cardio. So steps to EKG, AFib versus A-flutter. All right, Frederick just popped in to say I passed my NCLEX last Wednesday. Congratulations. Excellent job. All right, someone is asking, how do you answer reduction of risk questions if you aren't sure of the answer? So this is going to depend on the type of questions that you have. So let's see if we can find one. Reduction of risk. All right, so let's look at one of these together. So when you're looking at reduction of risk questions, they look something like this. The nurse is preparing to remove an intrajugular central venous catheter. It would be appropriate to place the client in which position for this procedure? Well, when we're taking these questions, it's really important that we realize this is still a learning environment. We're still trying to figure things out, and that's totally fine. So if you don't know the answer, I want you to take your best guess and learn from that rationale like we were talking about. So, we know that we are taking out a central venous catheter, and which position do we place the client in? So automatically, I see two things here. We have Trendelenburg, we have reverse Trendelenburg. So those two kind of draw my attention. But what do you think? How would you answer this question? Okay, many of you are saying letter C. So let's see how we did. And the answer is letter C. So if you notice, we kind of have two opposites. We have Trendelenburg and reverse Trendelenburg, and that's a test-taking strategy. When we see two opposite answers, chances are it's probably going to be one of those. So when we put that client in supine or Trendelenburg, and we could use either one of those to remove this catheter. So what happens is because of that, it's decreasing the risk that we could have an air embolism. Okay, so we don't want to elevate their head because, again, that increases the risk of air embolism. So if we have them down and we move them up, then we have the opposite effect. So I want you to get to the point where you can explain the why. What's going on? What's the concern here? So when we go back to this question, well, what would be a concern when I'm taking out a central venous catheter that's intrajugular? Well, an air embolism is a big deal. So knowing what's going on is going to be really important. And if you're still struggling with that after the fact, I would recommend going back and reviewing intrajugular central venous catheters, removal, placement, what we're looking at, and then understanding the why behind the answers that are incorrect. So when we are, obviously, when we're positioning, we want to decrease that risk of an air embolism. So high Fowler's, lateral, All of those things are contraindicated because it increases that risk. Great question. What other questions do you have? Someone is asking about pharmacology. So something I want to bring to your attention right quick is that we have a pharmacology. I want to show you where this is really quick. So nursing, we're going to go down here. We're going to scroll down. It's going to tell us everything that we have going on here at Archer Review. So we're going to scroll down just a little bit. Whoops, I think I went too far. Sorry about that. So, this kind of tells me what we have going on. So, pharmacology guess the medication will be next week. We have mastering cardiac pharmacology, and we have our pharmacology crash course. So, if you are someone that struggles with pharmacology, this is for you. It is actually 5 days. It's Monday through Friday, the 16th through the 20th, from 7 p.m. to 9 p.m. Central Time. And this is Lauren Korth going through the nitty-gritty of pharmacology. She'll give you tips and tricks. She'll walk you through the content of how to look at pharmacology, how to answer those questions. So you can see Monday is foundations, Tuesday is neuro, followed by cardiac, renal, and reproductive. It also comes with an ebook. She'll give you some flashcard templates to utilize as well. And it is recorded. So this is a $75 value, but I want to make sure that you know that this is here for you. So I'm going to go ahead and put this into the webinar chat for everyone, just in case you are curious. But let's go ahead and look at one of these together. So let's go back. We're going to finish this up, end it. All right, so we're going to go back to our QBank and we will do one next, and we're going to look at pharmacology. I'm just going to randomly choose, let's see. Let's look at neuro. Looks like fun. All right. So the nurse is administering the first dose of rivastigmine to a client with Alzheimer's. Which clinical data is necessary to monitor while the client takes the medication? What do you think? Okay, I'm seeing a lot of B, so let's go ahead and see. And it is letter B. So the important thing is we understand what is this medication for. So we know that this medication is given for what? With Alzheimer's, right? So we want to watch that weight. Common side effects, they have that flu-like symptoms, dizziness, weight loss. But why isn't it letter A? Well, glucose isn't an issue with this medication, nor is creatinine, nor is hemoglobin and hematocrit. So it's just important that we understand this medication. So being able to go back to it, understand the why is going to be really helpful. Excellent job. All right. So I know that was kind of the down and dirty. I hope this was helpful for you. If you have questions, please don't hesitate to reach out to us at nursing@archerpulse.com. I'm happy to help with whatever questions you have. And don't forget, this is recorded. It's on both our Facebook and YouTube channel. And so make sure you share with your friends, like, subscribe, and we hope to see you back for our next webinar on Monday. Take care.